Hi, everyone, and welcome to the May edition of Crohn's and Colitis Connect, another COVID edition where you're going to see us all doing videos instead of being live in the studio. So sadly, Dr. Dassopoulos, we were not able to get you into the studio this time, but hopefully next time we'll do it. We'll be able to get you again, hopefully in the future, because it's a lot of fun to have you in the studio. Later on, you're going to be hearing from my colleague, Jacqueline Leach. She's going to be talking to one of our longtime volunteers, Trisha Susman. So we're excited to catch up with Trisha. But right now, we're going to be talking to Dr. Themos Dassopoulos, and he is the medical director of the IBD Center at Baylor in Dallas. Prior to that, he was an assistant professor at Johns Hopkins University and director of the IBD Center at Washington University. Did I get that right? And
yeah.
You're also recognized as an IBD expert, so you are the perfect person for us to talk to today.
Well, nice to be with you, Alicia.
Thank you for joining us. So what we wanted to start with, and you and I had already chatted offline about this, was that there's been some updates as it relates to this COVID-19 business and our folks with inflammatory bowel disease, mainly just some updates on COVID-19. So can you tell us a little bit about what our community should know about kind of some of this new stuff that's come about?
Sure. So there have been two major developments vis-a-vis COVID-19 and infection in patients with IBD. There is a consortium that is putting together cases of patients with IBD who were infected with COVID. So there is a registry rather. So doctors around the world are registering their patients with IBD and COVID-19. So far, there have been, I just looked at it, 1,074 patients with Crohn's disease or ulcerative colitis and COVID-19 infection. And going through these preliminary and still accumulating data, we can say that we see several trends. One trend is that the older the individual, the greater the risk of COVID-19 infections. So you start seeing poorer outcomes once the individual is older than 60, which is the same observation you make in the general population. The second observation one makes is that, as again with the general population, the greater the amount of comorbidities, the poorer the outcomes. So patients who have coexistent high blood pressure, lung disease, liver disease, kidney disease, heart disease, etc. Those patients with IBD that have these comorbidities do worse than patients without IBD and these disorders. And again, that also occurs in the general population. Now, with regard to IBD, what we're seeing is that the only medication risk factor that is evident in these preliminary analysis is the treatment with steroids. And that reinforces what we've been telling patients for years and what patients themselves have figured out, that there is a lot more harm in the long term from the long-term use of prednisone rather than benefit. So as with our standard patient, so again with the COVID-19 patient, and even more so, we have to get them off steroids. A couple of other interesting observations are that the higher the BMI, the body mass index, the worse the IBD outcome, the COVID-19 outcome. And finally, although IBD itself doesn't increase the risk of COVID-19 infection, and even those other than steroids, the medications do not increase the risk of COVID-19 infections, what we are seeing is that severe IBD is associated with worse outcomes from COVID-19. And that's intuitive. meaning that the sicker you are, the more anemic you are, the more malnourished you are, the greater the problems in the function of your immune system, the more leaky your gut is, quote unquote, the greater the risk for poorer outcomes when you are infected with COVID-19. So on the one hand, then we have, as I said, these continually updated data that are coming in throughout the world, and you can look this up. It's called the Secure IBD Registry. Secure IBD Registry. If you Google it, you will find it without any difficulty. So there is accumulating data that really has informed our understanding of the risks of COVID-19 in our population. The second thing is, how do you put all this together, and what actual recommendations do you make to the patient? And we have all been, experts have been talking to each other. And finally, there is a document which represents the consensus of some experts who belong to the International Organization for IBD. And this has been published. It's actually, the draft is available online. And it makes certain recommendations about the management, the medical management of patients with IBD and COVID-19. And the big lessons there are, number one, get the patient off steroids like you would do otherwise. Number two, you should not stop the medications. If the patient is doing well, there is no evidence of infections with COVID-19, do not stop any medications, other than, of course, trying to get the patient off steroids, because the risk of stopping these medications is that the patient will flare, and then all kinds of bad outcomes will come into play. Again, steroids, anemia, malnutrition, hospitalization. So stay on your medicines. And now, once you do get, if that unfortunate event does take place and you get infected, then the recommendations are that you stop your therapies, you stop the immunomodulators, you stop the anti-TNF drugs, you stop tofacitinib, and you stop ustekinumab. There is some discussion as to whether you should stop necessarily vedolizumab. There is some debate. And again, these are just guidelines based on the expertise of individuals. We do not have firm scientific data, and that's why you see some disagreement among experts. So we'll know more about this, but again, the main lessons are, number one, get yourself off steroids as you would even if there was no COVID-19 around. Number two, don't stop any other medications. And number three, if you develop symptoms suspicious for COVID, or if you have confirmed COVID, then speak with your primary care doctor and with your gastroenterology about, of course, the need to test, and then about the specific changes in your medicines that will be necessary at that point in time.
Right. The only thing I would say is certainly getting yourself off steroids means working with your gastroenterologist to get you tapered, right? Because it's not a good idea to just stop, right?
Absolutely. And thank you for making that clarification, Alicia. When we say get yourself off steroids, it means make an attempt under the supervision of your doctor to taper your steroids. We do not just stop steroids, cut you off treatment just like that. Many patients are on chronic steroids, and then they have to gradually decrease the dose or taper the dose, as we say.
Yeah.
Yes.
So we want to do it smart. Don't just
yes.
do it abruptly.
Of course. Yes.
Good. Excellent. There was, the other thing I would let you know is the recommendations from the IBD. Yes. International organization, and also the sort of recommendations. You can find all of that on our website as well. So if you just go to Crohn'sColitisFoundation.org, the very top of it is our COVID page. You click on that, you can find all of this stuff in there. Under the IBD recommendations are under our professionals tab. So if you are interested in seeing that they can go visit that there. And the link to the Secure IBD registry is there as well. So they can see the same data that you're seeing, which is really pretty cool. I went on there a few weeks ago, and it was much smaller sample at that point. So I'm happy to see that people are utilizing that registry, because it isn't something you have to do as a physician. We're asking people to do it. And so people are participating, which is great.
And the people are presented in a tabular form. The data are presented in a tabular form. They are presented in a very simple way, and I think anyone can sort of look at these data and do understand them. It's very simple. You clearly see, for example, that patients who are on steroids do worse than patients who are not on steroids, or patients who are older than 60 do worse than patients who are under 60. So anyone can access that registry and that data and look them up for themselves.
Yeah, it's pretty cool. I mean, this was pulled together very quickly too. So I've been so impressed with how fast our community has responded and how fast our doctors have responded to this. And there's still so much we don't know. So we're still learning.
I think we're seeing in IBD what we're seeing in other fields of medicine is basically the international collaboration and a very enthusiastic participation from people all over the world to publish their experience, to share ideas, and we're all in this together. It is a race to sort of achieve health and cure and manage this condition. We're seeing the same thing in IBD. So we're seeing a lot of reports about case reports of patients infected with IBD, case series from Italy of patients with COVID and IBD. And again, this collaboration of the experts from around the world that culminated in the IO-IBD guidelines. So I'm very hopeful for the future.
Yeah, me too. Me too. I'm going to give you one off the cuff question. Hopefully you can answer this because we are almost out of time. Give me a second. I just forgot it. Is there anything that you're recommending to patients who might be nervous about, for instance, coming in to see you, or for any necessary procedures, or for things like their infusions? Is there any sort of advice you're giving to your patients about kind of times they're going to need to go into places where there might be slightly higher risk?
Well, that's a great question. And I think that in the midst of all this, we cannot neglect taking care of the rest of ourselves, and that is our physical health and mental health, etc. So we do screen our patients who come into the clinic for appointments and or infusions. So there's a questionnaire about fever, respiratory symptoms, etc. If the patient wishes, we have telemedicine encounters. Again, the best when it comes to endoscopic procedures, we are opening our endoscopy centers again, and again we're screening patients for COVID-19. Sometimes we actually test them for COVID-19. I think you have to balance the concerns for COVID-19 against the concerns for not acting on other urgent health issues. So if you need a colonoscopy to make an important decision about the management of Crohn's disease or ulcerative colitis, then you do need it. And the benefits of that procedure in terms of guiding management are far greater than the minuscule risks, in my opinion, of going to an endoscopy center and getting scoped. Again, the social distancing guidelines are enforced. Patients are seen, are spaced apart, both in clinic and in endoscopy. We try to have no more than one individual waiting in the waiting room. Rooms are being cleaned. So yes, we're concerned about COVID-19, but on the other hand, if there's an urgent issue with your IBD, it has to be taken care of. Now, if we're talking about an elective colonoscopy that needs to be done sometime in 2020, then that, and it's not going to affect immediate management of IBD, then this can wait for 6 months from now.
Right.
But again, both doctor and patient have to balance these considerations when deciding about clinic appointments and endoscopic procedures.
Right. Moral of this is don't make any big changes or moves without talking to your gastroenterologist, right?
Yes.
Good. Excellent.
Absolutely.
Good. Well, Dr. Dassopoulos, it has been a pleasure to have you on. We so appreciate it, as usual, of course. I'm going to pass it over to Jacqueline now, but I want to thank you again for joining us and thank everybody. Hopefully we'll see you in person next month, but we shall see. Thanks,
It was
Dr.
my
Dassopoulos.
pleasure as well.
Thanks.
Thank you, Alicia. I'm excited to welcome on today's Patient Connection, Trisha Susman. Trisha is a member of our Greater Dallas Leadership Board and also the parent of Julian Susman, who is our 2020 Rising Star Honoree. Welcome, Trisha.
Thank you. Thanks, Jacqueline. Thank you for having me.
Of course, of course. We're excited. Okay, well, let's get into it. You know, your son Julian was diagnosed at 13 months old with Crohn's disease. Tell us what symptoms he was experiencing that brought on the testing and diagnosis.
Yeah, sure. So actually, Julian as an infant, he really did not take to, one, he didn't take to breastfeeding, and then two, we went through a number of different formulas. And so actually pretty early on, we noticed that he started having some issues, and it seemed as though he often had a lot of pain or discomfort from when he was taking his formula. Ultimately, he really didn't start taking to food. So he did not have any kind of, really baby food, just he did not take to. He didn't take to any kind of other solid foods. And initially, we also noticed that he was experiencing pretty significant amount of projectile vomiting at 3 months, 4 months, etc. And we just kind of thought maybe there was an allergic reaction happening, and so we consulted with his pediatrician and thought at that time he might be actually allergic to rice, since we had started with rice formula and rice cereal. It kind of just went from there. He, like I said, he really just never took to eating solid foods, and we got to a point where his pain was just growing, and his level of discomfort, it was very difficult to comfort him. So we did seek out a specialist with a pediatric gastroenterologist when he was about 9 months old. We laid out the symptoms that we saw with Julian, and he actually thought it was a different type of a disorder, and in order to diagnose that disorder, he would have to do an upper endoscopy. But since Julian was only 9 months old, the doctor did not want to do that because of anesthesia. So we thought about just trying to do food therapy because he had become pretty orally averse. From 9 months to 12 months, though, the pain increased. He wasn't sleeping. He was waking every hour, and he lost weight. He lost a pound or two between his 9 month and 12 month checkup. So at that point, the pediatric gastroenterologist said, "Hey, let's just do this. Let's go in. We're going to do an endoscopy. I think that it's this disorder. Let's get in there and do it." And actually, when the clinician came out of the procedure, he was pretty shocked at what he saw. He saw quite a few ulcers throughout the upper GI tract. Julian never experienced diarrhea, bloody diarrhea. He never had any of that. So it was all this upper GI involvement. Ultimately, the gastroenterologist, he sent the biopsies off for diagnosis through pathology, and the pathology came back initially as chronic inflammation. But just kind of because of the work I had done and worked for a pathology company, I kind of knew a little bit more, not much, but a little bit more to ask some questions around that, and ask the doctor, did that make sense with what he saw on the scope? It just seems that of all the pain and all the challenges, it just seemed like a very generic diagnosis. And ultimately, the gastroenterologist, he did talk with the pathologist. They did some additional testing on it, and it was discovered that, in fact, in that biopsy and in that tissue, the things that they saw on it were actually very relevant for IBD, for Crohn's. And from there, we sought out additional medical consultation. So we sought out a specialized pathologist who really all that guy did was look at pediatric biopsies, and he indicated that yes, this was in fact Crohn's, and even though it was such a young age, that kids this age actually could have it. So it took, it kind of took a while to get to the diagnosis, but ultimately once we did, we immediately started him on prednisone and very quickly started him on daily Imuran. And that was November of 2010. And like I said, he was not eating. He wasn't eating solid foods, just still taking formula. And by Christmas, because the medications he was taking, he was eating solid food, he was eating pasta. I mean, it really made a difference. Getting the right diagnosis really helped us make sure that he was getting the right treatment as quickly as possible.
Absolutely. And that was so important that you just trusted your gut and asked additional questions following that testing.
Yeah, it's something that's probably a little bit of an unknown, and maybe, just because of the background I had, I knew what questions to ask, but I don't know that everybody does. But I would just say that if there's ever any concerns about what you're seeing with your child or you yourself, the symptoms that you're having, and you have these procedure done, a colonoscopy or an endoscopy, and it just doesn't match with what's either seen on the scopes or what the person's experiencing, that you kind of push and say, is that tissue reviewed by a specialized pathologist who has an area of expertise with GI pathology? And I think that's what really helped make a difference with us.
That's great advice. Well, as a parent of a young pediatric patient, what tools or resources were important for you as you began navigating this journey with Julian?
I think that when we first learned about it, we had, I think it just was sort of fortuitous that one of our relatives knew somebody who was involved with the Crohn's Foundation and was one of the lead women who started the parent chat group, I guess a number of years ago. And so we went and met her and her husband. And, I think the thing about learning about the parent chat group as a, solution for folks, for parents and families who are looking for some kind of support when it comes to learning about a diagnosis of IBD, that was pretty critical for us. I think the big thing in learning about the parent chat group that kind of also brought us to the Crohn's Foundation. And through all of that, like learning about the foundation, learning about a support group, learning about what the foundation did, learning about the different events that the foundation offered in regards to raising funds for research and treatments, that was pretty important to us, because I think what it did for us, it helped us to understand, there's a community out there, so it helped us to feel a part of, a group of people who are experiencing and going through the same thing that we were going through. That way we had questions to, bounce off of people or talk to other moms or dads who were feeling just as scared as we were about the future for our child. And I also think that in getting involved with that kind of a community, it helped us to expand our resources, and it also helped us it helped us gain access to medical experts. Because as you network and you talk to people, I feel like, a few people had said, well, have you checked with this physician, or have you sought out this treatment, or have you asked your physician about maybe this course of action? And all of that experience from others, I think, really helped us to navigate the first 6 months, if not the first year, about what to expect, who to turn to, who some of the experts were, not just here in Dallas, but nationally. And I think that was very helpful and very beneficial for us.
That's great. We are excited to bring back Parent Chat on May 28th. We're going to have our first meeting of the year, which is going to be a virtual meeting, and we'll stay tuned for some more information about that. We'll have it on a slide here.
Yeah, I'm excited for it. Really am.
Thank you for being part of that and keeping it going.
Yeah, there's been some really, great sessions along the way that I've attended, and a lot of really good information out there, and, a lot of resources, education, not just from sitting in those groups, but then also from the physicians or, mental health experts or dietitians that attended. They have really great examples and suggestions that people can follow.
Wonderful, wonderful to hear. Well, Julian is now 10 years old, and like many boys, he really enjoys sports. You shared with us his motto is just do it. Tell us about where he draws his inspiration from and how that motto has really helped him in facing the challenges with living with Crohn's disease.
He's all boy, right? So he is completely obsessed with sneakers. I mean, he's obsessed with football and basketball, but really his obsession is all around the sneakers. So, and predominantly Nike is his go-to. I mean, he loves Adidas and he loves Yeezys and all the other shoes that are out there, but I think it's his love for sneakers, his love for Nike, and then also, reading a book about, the founder of Nike, Phil Knight. It was in doing that I think that's where he drew upon his attitude of just do it, which is not always easy to get him to just do things. He's very headstrong. But at the same time, as it relates to his Crohn's disease, I think because this is so normal for him. I mean, 13 months, every day since then, he's taken medication, and this has been normal for him. And we've been very fortunate that his level of severity of his disease is not, it's been controllable. We've had some issues up and down throughout the years, but for the most part, it's been very controllable. And I think because it's normal for him, and that was some advice that we were given pretty early on, to try to make things as normal as possible for yourself, your family, and your child. And because this is so normal for him, his Crohn's is normal for him, he gets upset about it from time to time. But at the end of the day, because he just gets up, and every day he's going to school, or he's going to play his sports, or he gets on his video games, he just does it, because that's just how it is. His life is pretty normal when it comes to dealing with Crohn's, and I think that's where he gains a little bit of that inspiration from, as far as pulling from sneakers, pulling from Nike about the motto of just do it. Just got to, have to do it.
Well, I love that motto. It's a great one. So,
yeah.
Well, we are so excited to recognize Julian as our 2020 Rising Star Honoree at our Night of Champions event on November 6th. Yep. What does that recognition mean to you?
I kind of thought about this. I think that when I really thought back on everything, this IBD can impact anybody at any age, in any demographic, in any race, at any point in life. And to see that also with Crohn's and ulcerative colitis, there can be just a wide variety of levels of severity that people can have. Also, having a situation with Julian where he has been pretty stable, especially over the last 5 years. Physically he's been pretty stable. He's had some more emotions that he's had to deal with, and some anxiety that's cropped up around that. And we've, leaned into the resources that we found through his physicians as far as counseling goes, to kind of help him deal with that. But I think that honoring somebody like Julian, who is a little bit younger, at an event such as this really does demonstrate, it kind of encompasses the whole entire population or the community of IBD. It can impact anybody at any age, at any time. And it means that, some people may not have as severe of a disease as others, yet at the end of the day, an organization such as, say, the Crohn's Foundation and all of the events that help to raise funds, it's still needed. It's needed for all of those people who are impacted, adults, children alike. And the research that's out there for treatments and solutions down the road, I think that that's what it truly means is, when it comes to having him being being honored at this event in November. I think it's kind of a demonstration of, this is for everybody. This is for adults and children alike, Crohn's, colitis alike, with the ultimate goal. He kind of represents the fact that, everybody still needs some kind of community to lean on, a support system to have, and resources to be able to access through organizations such as the Crohn's Foundation.
Absolutely. Well, we're excited to spotlight him and celebrating together on November 6th at the Statler. So
he's very excited too, and he's already trying to figure out what he's going to wear and looking at different suits online. So he's very excited about it.
And we'll make sure to have lots of bread for him.
Thank you. Yes. That's what he lives on.
Yes. Well, Trisha, thank you so much. Thank you for being on today and for accommodating us in this environment. I appreciate you.
Yeah, thanks for having me, Jacqueline. It's nice to be able to share any kind of level of experience, and it is an interesting time, and so doing this all virtually is quite interesting, but hope to be able to do something along these lines again, and look forward to all the events later on this year.
Awesome. Well, thank you so much. Up next, stay tuned for our upcoming events.